My name is Tony Marie Mendez. I've been with Claremont Lincoln University pursuing my master's degree in organizational leadership with a focus on human resources. I completed my capstone on the topic of employment barriers for people in recovery and the future of talent acquisition. This is important to my local community in the East Valley of Arizona because we're like a mecca for recovery. We host a large amount of treatment centers. A lot of people come here to get sober and then are met with barriers to employment due to stigma and bias and overbroad criminal background check procedures that are proven ineffective. So my capstone action research sought to really understand the prevalence of this problem in my area. I conducted this research using surveys. I'm really happy with the way the project turned out. My original thought was to do a podcast to raise awareness, but it was kind of putting the cart before the horse. With this research, I was able to see that awareness needs to be raised with the benefit to employing people in recovery. It can be avoided to get lawsuits due to discrimination, but also the people in recovery have their own set of skills and formative life experiences through getting sober that really guide in mindful ways and really help with collaboration and leadership and being a part of a team and working towards a common good. And unless somebody's personally affected or you're really close with someone in recovery, it seems that people aren't aware of this. So after this research, I'm really hoping to take it and start a podcast to kind of share those experiences and how it shaped the way people conduct themselves professionally. Right now, most practices are evaluative, and they really focus on the risk due to these past transgressions. And then, somebody makes the changes, somebody gets sober, and they're met with resistance. And this is kind of a big deal right now due to the opiate crisis that we're currently in, that was declared a public health crisis in 2017. The numbers are staggering, and that's current. So when we think of the ramifications 2, 5, 10 years down the line, if we're disqualifying this many people now, as those numbers continue to grow, as the numbers of people who are addicted now and are finding treatment, the longer it goes where we have these evaluative practices, the harder it's going to be for organizations to stay competitive, to acquire candidates with the right talents to help them succeed. And that's what this research focused on. The problem I sought to identify with my capstone action research and the ideas I wanted to explore centered in discriminatory practices that exclude people with a history of addiction who have a criminal record or a gap in their employment experience. These hiring practices, using evaluative processes to review the information, are ineffective and pose a risk to the future of talent acquisition. So when we talk about discriminatory practices, addiction is a disease. We don't disqualify diabetics or epileptics, but somebody with an addiction who has a criminal past, we automatically write them off, never asking why. Did this happen in the past because you were addicted, now you're sober? Did this happen in the past because you didn't know you were sick and you had this disease? Nope. We just see the criminal record and we say, this is a liability. We can't do this. And these hiring practices using evaluative processes are going off of subjective information. Sometimes it's an internet search. Sometimes it's done by a specific criminal background check company. But these are proven ineffective, and it leaves talented people outside of the door for something that may have nothing to do with the position, may have nothing to do with who they are today, but yet we have these above broad background check policies, and the talent that comes in is lessened. And it doesn't take the whole person into account. We're not asking about who are you today, who have you been. We're saying whatever you are today no longer matters because this is what shows in your record and this is what we're looking at. Communicative approaches are more ethical and effective and are being used selectively. So one of my favorite communicative approaches that I wrote about in my capstone action research as well was the fingerprint clearance card process in our area, Arizona. Most states have something like this. Whenever you work with the vulnerable population, children, the elderly, hospitals, things like that, you get a fingerprint clearance card. This requires a candidate to go get their physical fingerprints scanned And the physical fingerprints turn back anything that you've been physically arrested for. So this is like tangible, very real information. Once that happens, it's sent to the Arizona Department of Safety. They send you a letter and say, hey, you're denied because of X, Y, Z. They let you know the exact offenses which came up based on your fingerprints. You are then allowed to apply for a good cause exemption. You now can communicate with the board to express, I've paid my debt to society for each of these infractions. This is why I did those things. This is how I've changed since I did those things. And then you provide reference letters from 3 people you're not related to that can speak to your character, that can speak to your personal change. And based on that, you can be allotted a good cause exemption. And this is a beautiful process, and it's done at the cost of the person who gets their fingerprints. I wish it was more widely used, but it's way more effective, but it's only being used selectively in that official capacity. There are some organizations who have embodied a more communicative practice just implemented into their culture. Organizations should be informed of the benefits to employing people in recovery. The stigma and bias that as a society we have faced when dealing with substance abuse has been a long road. And we've turned a corner when thinking about addiction and alcoholism, substance abuse as a disease. And we've turned a corner that you cannot be fired for seeking treatment. Most big organizations have employment assistance programs that will help people find treatment. And we've turned a corner that way. But on the other side of the spectrum and the journey, when somebody is sober, if they're not already with the organization, how do they get their foot in the door? How do they explain their past with people who haven't been there the whole time? And that's where the benefits of employing people in recovery really comes into play. If we're only focusing on the risk, we're always going to see it in a little bit darker light, but focusing on the benefits and seeing what could possibly happen could be a turning point on this issue. So I sought to study practices in place in my local professional community and the impact this could have long-term in acquiring talent and how informed stakeholders are on the topic. So I wanted to see, in an area where we're a mecca for recovery, how are we approaching this? And is it being ethically, mindfully, corporately, responsibly carried out? I executed this by using qualitative data from surveys that I conducted online. Some statistical information that was big that I found in my literature review, and just to kind of condense it into one piece of information, just to see the impact that this can make, is that 92% of employers conduct a background check. There was one study that I found where 15,000 applications were submitted to online job postings. And of those, anyone with criminal records were receiving 60% more callbacks. So if you didn't have a record, just based on this surface level resume, whatever application submission, you were 40% less likely to get a callback if you had a record. In 2018, it was estimated that 1 in 3 Americans have a criminal record. So that would equate to 77 million people. But 7 years prior, in 2011, it was estimated 65 million adults had a criminal record. So just in 7 years, we jumped by 12 million people. When it comes to substance abuse, 23 million Americans have struggled with addiction, and 5.3 to 15.3% of the U.S. population are in remission from significant alcohol or other drug problems. So that would be around 25 million to 44 million people who are in recovery. So this is the amount of people that are affected by these policies. So literature reviewed, I studied corporate social responsibility and ethical practices. I looked into understanding qualitative research. I looked for information that regarded the criminal record statistics and explanations about substance abuse. I have the working knowledge. I needed to make sure that the reader was informed on the topic. I looked for information regarding the public health crisis that was declared due to the opiate use and coordinating their approach. I made sure to present evaluative process as discrimination, right? Like I wanted to look into the other ways this has been looked at and exactly the statistics of how these evaluative processes affect the population. I looked into options for communicative approaches. There was the fingerprint clearance card, but there were a couple other ways that people studied testing this out. And then I looked into insights on communication and leadership selection in an evolving workplace to kind of understand how long-term this can benefit just the overall morale and culture within an organization. Two of my favorite references that I used and that really guided my research were in Synthesis of Theory. There was one gentleman who put forth his experience in the 12 steps and his experience getting sober as a formative life experience that changed his leadership. And he wrote a really interesting paper that really guided a bunch of my research and my understanding of why it was important and why it was a benefit. And then for Synthesis of Practice, Dare to Lead, Brave Work, Tough Conversations, Whole Hearts. Brene Brown is one of my favorite authors, favorite practitioners, and that really helped me understand the relevance and validity to the information and my ideas. So my research method was to conduct online surveys. It can kind of be broken down into 4 parts. So I wanted to look at the demographics, so like what industries, what ages, what genders, where were people in their organizational hierarchy. I wanted to look at what background check processes were being used and the effect it was having on the talent pool that an organization was seeing. Were people often being denied? Were people rarely being denied? And I established opinions and experience. So were these people believing that people in recovery deserve redemption? Do they have any involvement with the recovery community? And then willingness to discuss further was really just like, how involved are people on this topic? How much are people willing to discuss this with? And also it gave me information to move forward with this research should I choose. So some interesting findings were 10 people were sent the survey and 61 people responded. That's how many people shared it, were engaged with the topic, and that was really energizing and motivating for me to see how many people wanted to talk about this, wanted to have their opinion be heard, and that was really awesome, for lack of a better word. Multiple industries were represented. So I got responses from a bunch of different industries, but I was a little disappointed that the food service, hospitality industry did not engage. All age groups were represented, but more women than men did respond. What was also interesting is that of the demographics, a third were entry level, a third were middle management, and a third were upper management or leadership. And approximately 2/3 of the participants self-reported that they were in recovery themselves. And that was really awesome, because of those in recovery, 12 were in leadership and 13 were in middle management. So for me as a researcher to see that there were this many people who have overcome these barriers was a really unique thing to see, and also fueled my awareness. And for further research, it would be interesting to see if it was unique to our area, but it was really interesting to see that so many people in leadership were in recovery themselves, and yet we're still reporting they sometimes had to deny people based on that background. So people are being asked not to live aligned with their own personal values. So the industries represented, nearly half were in the healthcare, behavioral health, mental health field. And then we also had finance, technology, nonprofit, construction. We had one person respond from retail, and then there were others represented. So if just looking at the graphic, to see that many people in healthcare, behavioral health, mental health who are on the front lines working with this population be so energetic in sharing their responses was a very interesting part of what this researcher found in the survey process. And then when it came to background check policy responses, so there was a huge amount that were none. They just don't do anything. Some used other, and then it was like a mix between evaluative and communicative. So what was interesting is that the industry standard background check, the limitation in the research is that some people were clicking 2 options. So a lot of people clicked industry background plus the fingerprint clearance card, but there was still a huge amount that use evaluative procedures and leave it up to either the fingerprint clearance card process. You got to go figure this out, but their process is once you're evaluated, once you have a criminal background, then you have to go figure this out, and then you come back. So there's still a huge prevalence in background check responses. So when it comes to background check policy by industry, I was a little surprised to see that there was no gold standard in any industry. Like, no industry was predominantly one thing or the other, except for retail sales. But again, only one person participated from that industry. But overall, no other industry had a gold standard. So that goes to tell me that, like, it really depends on the individual leadership of an organization of which way they're going to go. Like, because if you can have this much difference in approaches in 61 people, half of them were in healthcare, but there's this many differences represented for each industry, it's confusing as to why we don't have one gold standard or one best practices approach when it comes to background check policies. And familiarity with benefits of hiring people in recovery was one of my most impactful findings, because people were extremely familiar, very familiar, but then there was somewhat familiar, not so familiar, and not at all familiar. So nearly half weren't very familiar with the benefits. So it's interesting to me that we're judging harshly on the risk, but we're not even aware of the possible benefits. So for me, the furthering of my research and further understanding, is really trying to figure out how to let people know the possible benefits, because there are a lot. So impact and implication. So the zeal of response from healthcare, these people who work on the front lines while people are recovering, their response and their enthusiasm on this topic was really affirming to the need for it to be discussed. I also found that there's still a prevalence of evaluative background check procedures, but for the participants of the survey, this didn't cause extreme consequences due to an addition of conversational practices. So we're still seeing the evaluative approach where some people may not feel comfortable talking about it, or may not be ready to, but of those that did discuss it and did have some space to kind of address it, they weren't often or always denied. So that was positive. The lack of consequences reported for evaluative practices that incorporate communicative practices shows that the positive impact that mindful approaches can have to onboarding. And due to these holistic practices, organizations that function in that type of system can acquire more talented candidates than those that do not, and as they are denying candidates due to subjective background information. And there needs to be awareness raised for the benefit of employing people in recovery. Nearly half of the participants were not familiar with the assets of employing people in recovery, and those were major implications of my research. Thank you for taking time to watch my presentation. I just want to end off with the idea of you might be a little confused about why we're talking about criminal backgrounds, gaps in employment, and those who are in recovery from substance abuse. And the idea is, that's covered in my research, and I'll just recap it. That disease comes with its symptoms and behavior patterns, which on paper look like criminal negligence and irresponsibility and inconsistency. But the reality is that once people have found treatment, once people have entered into recovery, those things are not prevalent in their behavior anymore. It's the same way a diabetic that can't manage their sugar, that doesn't know, might have to take a nap in the afternoon because they're in a hypoglycemic drop. Similar, if somebody's addicted and active in their disease, they do things they're not proud of, they do things the law probably thinks they shouldn't. And so when it comes to human resources and organizational leadership, I hope that we can approach this in a more mindfully, ethically, and reasonable way, where all talent can have a space to apply for positions and there can be equality. And I think that is the takeaway for my capstone action research. Thank you very much.